From the very beginning, Penn has always been about one thing: caring for people.
Penn was the first hospital. Penn was the first academic medical center. Penn was the first school of medicine.
That's why for more than 2 centuries, some of medicine's greatest luminaries have walked our halls. And while the world keeps changing, our deep dedication to our patients and the people who care for them never does. That is the driving force behind our new patient pavilion.
The design of this building is transformational.
The next step in our never-ending quest to go beyond just patient care.
This is a very new plan for delivering medicine in the 21st century.
By designing a place specifically for our healthcare teams to offer new and better ways of bringing wellness and hope to our patients.
The rich history that has become Penn has helped inform the country, the world, where medicine is going and what's possible. This is so much more than a building.
The vision of the new Penn Pavilion is not limited by old ways of looking at hospitals. Instead, our new guiding principles expand the horizons of care by designing for change and a better patient experience, unrivaled care, and an unprecedented investment in the community, all through insightful, thoughtful innovation. Things like human experience workshops and full-scale inpatient simulations that map the care journey of our patients and healthcare providers to improve the whole process.
So we've been able to prototype inpatient units, we've been able to prototype surgical floors by actually building full-scale mock-ups.
We're designing the actual setup, where the lights are going, where the OR table is, where the various imaging instruments will sit in order to facilitate good workflow.
And in some cases, we're talking about 30,000 square feet of mock-up, which is an enormous endeavor to ensure that what we build ultimately will function as we intended.
I think sometimes when you're looking at drawings, people are in this position of trying to imagine how they might act. Through the course of these large-scale simulations, we get to observe exactly how they act.
The ORs, the labs, the patient rooms, even the wires in the walls are designed for maximum flexibility and adaptability with many modular components. The entire building is designed to be ready for technologies appearing decades down the road.
We don't know what the next 20 years will bring. All we know is that we have to be prepared to integrate information technology, new imaging advances, new therapies, and we have to be able to have a building that will accommodate all of that.
This patient-focused design means easier, more holistic care with a personal touch.
One of the best features is actually the room itself. The rooms are large, they're all single rooms. There's enough space for an entire team to meet with the patient and their family members and discuss plans of care.
The floor is also set up that we have space for family meetings or larger team meetings, that there is space that's available.
Integrating families into that space helps patients get better faster.
The design, it's really a commitment to our mission here at Penn to provide the highest quality care, keeping the patient central to the mission.
A few of the features that really stood out for us were the observation window, where a nurse or a staff member can observe a patient without actually going into the room. The second one that was brilliant was being able to stock the room with linens and other supplies from the hallway without ever entering the bedroom.
It is built on a modular framework that includes even the interventional program and layouts, but also the systems that go behind it so that they can be serviced, they can be expanded, they can be replaced without having to start over from scratch.
The operating rooms specifically are going to be designed not so much as a surgical place, but rather as a procedural place, both for interventional cardiologists, vascular surgeons, and heart surgeons, so that any room could be used to fulfill whatever needs are prominent at the moment.
The patient may stay in the same place, and as they hopefully journey in a positive way through their illness, they will go maybe from an acute care setting, but the care team around them will change without them having to actually move beds or rooms.
This is the first building that we've designed from the bottom up, thinking about the patient first.
As we personalize our treatment planning for people, we also want to make them feel like they're not part of a machine.
So any effort that could make the experience more pleasant, more efficient for both the patient and everyone providing that care is a great thing.
It's simple. Personalized medicine in a customizable space means better care. It also means a more dynamic and rewarding work experience.
When the staff are happy, patients are going to be happy, and that's going to be good for the patient's health.
Caregivers here will have a hospital worthy of our world-class faculty and the patients they care for. A bright, humanistic place full of new technologies coupled with new care models.
This will allow for fostering of better teamwork and better communication and make sure that the staff really are comfortable and able to do the best in taking care of our patients.
All in service to the one thing they care about most, unsurpassed patient care.
What's unique about this project is that we co-locate with the Penn Medicine staff as well as with the firms that are involved in the project.
This integrated project delivery process is different for us. This is the first time we've done it, where we're all together in the same room, we're all under one contract. That is really very unique.
You're collaborating and working and talking and sharing and challenging each other all the time, and that's where you get your innovation.
The process has just been incredible. Everybody's voice was really heard.
That inclusiveness, I think, has just made people even more excited about what this is going to be.
Everyone's going to feel a part of this building when it's done, myself included, who will say, I had an impact on how this looks. I had an impact on how this flows. I had an impact on how patients are being treated.
It's a fact. The Penn Pavilion will be a groundbreaking hospital and a state-of-the-art green building, both a historic construction project and an economic boost to the city.
This would be a wonderful partnership and an important legacy for anybody that wants to contribute to this remarkable vision.
This facility will be the easiest, most accessible, most connected medical complex in the region. So of course we're proud, but never so much that we lose sight of the big picture, which of course is the little picture. That's how we know these gleaming new halls would be empty without that true spirit of caring.
Medicine is evolving. Our ability to care for patients is evolving. This building will allow us to practice medicine now and into this next century in a way we couldn't have done it before.
That devotion to teaching, to serving, to high tech, but with a personal touch. That is everything. That's who we are and who we will always be. And that is the rock on which we build. Join us